Why do we care about prediabetes? Well, there are at least two reasons why it's important to think about prediabetes. The first is, if you have prediabetes, it can develop into type 2 diabetes. And the second is, prediabetes in itself is a sign that the body isn't happy. So let's think about why we don't want prediabetes to develop into type 2 diabetes first of all. If you develop type 2 diabetes, the risk of things such as stroke, heart attacks, foot ulcers, kidney disease and eye disease starts to significantly increase. Now, all is not lost if people develop type 2 diabetes, but if we can avoid it, then that would obviously be preferential. With prediabetes, the blood sugar is starting to rise. It hasn't quite yet reached the level of type 2 diabetes. So by taking action, we can hopefully prevent that progression and potentially even reverse prediabetes. So that's the first. The second reason prediabetes is important to think about is actually as the blood sugar is rising and the body is struggling to control blood sugar, that happens in prediabetes, this is actually a sign the body is already not happy. The body is struggling with its internal balance. You can kind of think of it as being a bit at war with itself. And with this, we get some other problems, such as raised blood pressure. The body also finds it difficult to burn fat, and we lay on fat around our belly. We may also find that we are at increased risk of some skin problems, such as skin tags. We're hungry more often, and a multitude of other problems. So prediabetes, although we often just focus on it having a slightly raised sugar level, actually it's a sign that far more is going on behind the scenes. So two key reasons why we're interested in prediabetes is one, we don't want it to progress to type 2 diabetes, but two, and perhaps more importantly, prediabetes is already a sign that the body is not happy with itself.